Hi guys, so this is another video with the same clothes. I'm doing it at the same place. So this video will, I think, air on tomorrow or on a Tuesday or on a Wednesday, I'm not sure. So this is me, my personal experience, and me, myself, and I rating how healthcare in Kenya is right now. So healthcare in Kenya right now is, I would give it a 6 out of 10, but it's not there yet. So if you live in Nairobi, you experience more healthcare accessibility, but if you live in the rurals, you don't experience it a lot. Yeah, so in Nairobi you can access an ambulance, you can access an ambulance, radiotherapy, you can access a lot of healthcare things, and it's quality. But when you're living in the rurals in Kenya, like let's say in the outskirts, not in the outskirts, because I even know Nakuru offers chemotherapy and radiotherapy. Yeah, but if you live at the rurals, you just know you can't even access an ambulance, you can't access good quality. Kwanza there, the doctors are like, you guys are poor, like you're never taken care of seriously, and the issue ends up complicating. So yeah, so you guys have heard that there was this person, a famous woman, who delivered outside on the barabara ya Nairobi, and the ambulance could not take care of her. And I was like, wait, maybe kuna polisi ya ambulance kunini kukosa kuchukua mtu akiwa amedeliver hapo, but I don't think there is. That was an emergency ambulance tu ingemchukua. I think they refused because they were not competent, but I really don't know. Maybe kuna police. Yeah, so here, like in our place Makindu, like there are ambulances, but I usually see them like going out when there is, let's say, an accident, yeah, ndio wawalete hosi. But here, even we try and save lives, but hakuna even neurosurgery. The hospital doesn't have neurosurgery. Maybe it's because not many people in this area suffer from it, but it's supposed to be there. Also, there's another. So in the rurals, I've hardly heard of msee kupigia ambulance ikuje. I've never actually heard of that here in the rurals, but in Nairobi I know you call the ambulance to come, and I don't know why, because yeah. Also, another thing here which you find it peculiar, people are never let's people are never treated like seriously. In Nairobi, like unaweza patana na msee mwenye ako na pesa alafu mumtreat poa, watu atritiwe poa, but here things often complicate and you're not even treated poa, and some of it to blame is the government. Like in our wards, when I was like in 1.2, hakukuwa na inaitwa madawa, so the patients would go for the drugs or send relatives, and it makes me wonder. So kama ukuwa na relative, you can send a nurse unakaa bila dawa, or unamtuma akitoka shift, so umekosa dawa yako ya hiyo time. So kuna saa zingine hata kuna dawa, like when I had a flu also in this semester. I had a flu, I could not speak, and I went to get my services from our nearest public facility, and they did not. I was prescribed for loratadine and PCM, paracetamol, and they did not have loratadine, which is a very common drug. Yeah. So yeah. Also, there was a time there were no fluids in our hospital, like, and fluid. Yeah. So that's another thing. Also, in some places you find like in our place gum cutting is more done, but in other places gum cutting is never done. Like it's like our place does not have malaria cases that much. So in other places like Kisumu, huko sides za Lake Victoria kuna hiyo malaria cases, hata Mombasa, and it's just down there. So you can stock on malaria drugs and hakuna malaria drugs literally. Yeah. Whoops, karibu nianguke. I'm sitting on a rock. Okay, I'll cut that part. So yeah, so healthcare in Kenya is a major. I just hope that wish the government would like bring it, like hata wasi wa rurals wanaweza access ambulances, cause like me, my personal experience, my mom was admitted in here around here, and we could not access an ambulance. Walikuwa nasema lazima itoke Wote, and Wote is like 3 hours from here, and she had an hemorrhagic stroke which was really bad, and like they were like policy inasema ambulance inafaa kutoka Wote, si Makindu. And I was like wa ndio ifike, alafu huyo dereva ndio anaenda tena Nairobi. So even now, even in our place there is no cancer center, and you get like most men get, I've seen a couple of cancers like breast cancer, a lot of cancers were bladder, that I've seen bladder cancer of the bladder, and prostate, and there's no cancer center. And in our hospital we offer palliative care, but we don't really offer chemotherapy or radiotherapy. Yeah, we just do diagnostic. There is an CT scan, and it's the only CT scan in this place, and you'll find most of the rural places in Kenya, that's what they do. Like they have one CT scan, so people get referred to this place. Yeah, but there are 2 surgery theaters, which that is a big up, but I hope the government would like scale it up a little and consider these people. Yeah, another thing that I wanted to talk about is training. Here there is no mentorship programs. Kwanza in our local hospitals there are no mentorship really. So like maybe when they are told like to go to somewhere to like learn about the new techniques, only that, and it happens like not every time. Yeah, so there are no mentorship and just like healthcare, like you need to be everyday educated, because new drugs are gonna come in the market, you won't know how to use it. Yeah, also there's a lot of stealing of drugs internally and externally. Internally meaning inside the hospital and before even they reach in the hospital. Maybe that's one thing that makes people not even have a common drug like loratadine. So yeah, those like stealing from the government. Also I think healthcare literally is expensive, and in rural places I don't think most of them have an insurance. Yeah, maybe most of them don't have an insurance cover. Like if you don't work in a good place, like how will you even afford an insurance cover? So maybe like insurances in the rural places are not like that. In Nairobi, I think you have to pay NHIF, NSSF. Actually, minority of the people living in rurals, they don't even have an NSSF, and even an NHIF, which is the commonest, and you pay like 500 shillings per person, and rurals don't. Majority of them pay in cash, but majority also have UHC. UHC is universal health coverage. Yeah, majority of them. So yeah. So another thing is that insurance. So I think I have said everything. So my recommendations is, I wish NGOs and literally the government, because you can't ever depend on an NGO all your life, would scale up the healthcare in rurals like they have scaled up in Nairobi, in our capital city. Yeah. So bye guys. See you on the next one.